Hi, good afternoon. I see that you are here for a cranial nerve exam. Okay, well, first off, let me just explain to you what we are going to be looking at today. So the cranial nerves are the ones in your head that kind of take in all the signals from the sensory parts of your body. So we have sight and hearing, smell, taste, and finally touch. So today we're going to have a look and see to make sure that all of those nerves are functioning properly. Now before we get started, just a couple of details I need from you. Could you just confirm your name for me, please? Okay. And spell your last name for me, please. Fantastic. First test passed, hey? Okay. Before we get started, I see down here that it says you've had a few problems with your heart and blood pressure in the past. So just before we get started with the cranial nerve exam, I am going to use my stethoscope and just have a wee listen to the inside of your chest, make sure that everything is okay. So if you could just open up your shirt for me so that I can get onto your bare skin. Okay, I do apologise, it is a little bit cold, so that should heat it up just a little. Okay. That all sounds perfectly fine. You have a perfect rhythmic heartbeat, which is good. So let's kick on with the exam. Now the first part I am going to do is with your smell, your sense of smell. So I have several little tubs of scent, and I want you to just smell them and tell me what you can smell, okay? And what do you smell? Correct. And the second one. What do you smell? Good. Third one. What do you smell? Yes, excellent, excellent. And number 4. What does that smell like? Yes, excellent. And number 5. Now this one might be a bit tricky. It can kind of smell like 2 things sometimes. Yes, excellent. That's exactly what I think it smells like. Good job. And this one. And what do you smell? Next. Just tell me what you smell. Fantastic. next one. Yes, correct. And this one. What do you smell? Yes, excellent. And finally the last one. And tell me what you smell. Fabulous, excellent. Yep, you got them all totally correct. Which means your sense of smell, and generally by extension your sense of taste, must be working perfectly. So the next part of today's test is a simple eye exam, and we're going to do this in a couple of stages. The first thing I'm going to do is test your peripheral vision, okay? And what I'm going to do is I'm going to hold up my fingers, and I want you to tell me when you can see my fingers, okay? So just give me a wee shout when you can see my fingers. Good. 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 Uh-huh. Good. 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 Excellent. Looks like your peripheral vision is working okay. So now for a very simple eye exam, I'm just going to hold up my fingers, and I want you to tell me how many fingers I am holding up. Okay, so correct. Good. Good. Correct. Good. Correct. Excellent. Okay, so, and now we are going to look at your pupil focusing. So I am going to hold up my finger in front of your vision, and I just want you to follow my finger as I move it back. Okay? So, if you could just cover up your right eye for me, please. And just follow my finger back. Excellent. And again, just follow my finger. Good. And one more time. Good. Okay. And now could you cover up your left eye, please? And once again, you're just going to be following my finger. Just follow my finger back. Good. 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 Excellent. That all looks fine. Now, I'm going to be looking for the blind spot in both your eyes. Both of your eyes contain a spot at the back where all your optic nerves leave and go to the brain. So I just want to make sure that that's all normal. So if I can ask you once again to cover up your right eye, please. And I want you to follow the tip of my pen. Now when I move my pen into the right spot, it should disappear from your vision. So I want you just to tell me when it disappears, okay? And reappears. And disappears. And reappears. And disappears. And reappears. And disappears. And reappears. Okay, excellent, that looks normal. So now if you can just cover up your left eye for me please, and we're going to do the same again. So disappears and reappears and disappears and reappears and disappears and reappears. Good. Fantastic. You're all looking good. Okay. So now I'm going to have a little look at your pupils. Sorry, not at your pupils. I'm going to have a look at your retinas at the back of your eyes. And to do that, I'm going to use a little light to shine them in your eyes. So hopefully it won't be too bright for you, but you've had this done before, so I'm sure you'll be fine. So if you can just look straight ahead for me, please. And look down for me, please. And up for me, please. Look down again for me, please. And look left for me, please. And right for me. Fantastic. Now, if you can just cover up that eye, and I'll have a wee look at your other eye. Now, look up for me, please. And down for me. And left for me. And right for me. And look down for me again. Fantastic. Okay. Now just another simple test. We're going to use both eyes for this. I'm going to once again use the light, and I just want you to follow the light for me. So just follow the light as I move it across and back, and follow up and down and up and down. Smashing. Okay, so now we're going to have a look at our chart. So I'm going to hold this quite close to you. I just want you to tell me the letter that I am pointing to. Okay, so just correct. Yep. Correct. Mm-hmm. 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 Yep. Correct. Mm-hmm. Yep. 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 And that's you for your eyes. Excellent. So your eyes seem to be functioning very well. Obviously, it wasn't a very comprehensive eye exam. So if you haven't had one of those for a while, I would recommend you booking yourself in for one of them. Now, next thing I'm going to do is to do with your sense of touch. And first off, I'm going to gently touch your face. I just want to check for symmetry and any kind of abnormalities there might be in the shape of your skull. Okay, so I'm just going to gently lay my hands on your face like that, and I'm just going to go down. Mm-hmm. Okay, and just under your chin. Okay, yep, and down here. Yep, excellent. That's all fine. You actually have a fairly symmetrical face, which is good. It's a good sign. So now we're going to do some experiments, as it were, with the muscles in your face. Okay, so I'm going to ask you to pull some funny faces. The first thing I want you to do is just to lift your eyebrows up as far as you can. Okay, just lift your eyebrows way up. And now I'm going to try and gently just push them back down. Okay, and just resist me. Okay, and relax. Fantastic. Now I want you to pull your biggest grin. So just grin as big as you can, your biggest smile. Excellent, and relax. And now just puff out your cheeks, so just puff them out as big as you can. Excellent, that's fine, and relax. And can you stick your tongue out for me, please, just as far as you can? Excellent, okay. I'm actually just going to have a wee look inside here. Say ah for me. Excellent, okay, and relax for me, please. Now, some other muscles that we're going to have a look at. If you wouldn't mind just shrugging your shoulders as tall as you can, just shrug them all the way up. And once again, I'm going to try to gently push them down. Okay, so I'm just going to try and gently push them down. Just resist me. And keep resisting. Excellent. Fantastic. Good job. You're doing very well. And now, similar to last time, what I want you to do is hold your hands up around shoulder level with your palms facing up, okay? I'm going to gently push down on your palms. Just push back. Resist me as much as you can. Good. Well done. That's all fine. And now, what I'm going to do is just check the reactions, the sensations in your face and in your cheeks, okay? So I've got here, I've got a Q-tip and I've got a needle. Don't worry, it's not a very sharp needle, there's nothing to worry about. I want you just to tell me which one I am touching you with. So I'm going to let you feel them first, okay? So this on your left cheek is the Q-tip. And on your right cheek, this is the needle. So as you can see, it's just a little bit sharper. So now I want you to close your eyes, and I'm going to touch you with either the Q-tip or the needle. I want you to identify which one it is, okay? So close your eyes. Number 1. Q-tip or needle? Correct. Number 2. Correct. Number 3. Correct. Number 4. Correct. Number 5. Number 6. Number 7. And number 8. Yep, that's all looking perfectly fine. And now, for the last thing we're going to examine is your hearing. And what we're going to do is I'm going to lean round and whisper some words into your ear. And I would just like you to tell me what those words are, so just repeat them back to me, okay? I'm going to start with your right ear, okay? Flip-flop. Saucepan. Easter egg. Water bottle. Bed sheet. Coffee cup. Piggy bank. Calendar. Well done. And now for your left ear. Wine glass. Curtain rail. Lampshade. Hairspray. Coconut. Picture frame. Teddy bear. Excellent. Good job. Well done. Yeah, I just pretty much have to make them up off the top of my head. Yeah. Looks like everything went very well. Your cranial nerve exam has been a success. I can't see any discernible problems, but obviously if you do feel any problems, just call us up and book another appointment, and I'd be very happy to see you again very soon. Okay, take care.